There are many patients who choose a specific product or pharmaceuticals or even services such as laser or rejuvenation machines, but unless you address the root cause and address the internal disease, you might not get the best result and you might not get the long-term result that makes you happy. In this video, I will show you how choosing a proper treatment plan and a preventative measure could save you money and your time, and at the same time make you healthier and happier. Our subject today is hormonal imbalances, and specifically minimal hormonal imbalances. And when I say minimal, I mean with the routine lab test, we cannot catch the abnormalities in the patient's blood level. So patients comes in with different signs and symptoms such as hirsutism, which is unwanted hair in certain spot on the body, such as chin, chest, upper back, acne in different ages, like between 20 to 55, up to even 57, 58, and they have again acne on T-zone, the chest, on the upper back areas, and the other symptoms would be mood swing and also droopy muscle, droopy skin. These are the symptoms that patient comes in, and we don't have any solution for that because there is no abnormality in our lab test. In the next slides, I'm trying to explain what should we do in cases of minimal hormonal imbalances and specifically hirsutism, and I hope you enjoy it. So one of the presentations of hormonal imbalances is hirsutism. Now, is hair removal laser effective in this case, and when is the best time to do so? And if we have minor imbalances in our hormones, such as testosterone, estrogen, and progesterone, could we actually test it? Could we identify this in our blood levels? Now, we need to keep in mind that even minimal hormonal imbalances, especially in sex hormones, such as estrogen, progesterone, and testosterone, could cause hirsutism, along with some other symptoms, such as low mood, low libido, acne, etc. And in this case, even if you receive multiple hair removal sessions or multiple hair removal laser sessions with the best laser machines, results would be minimal. Now, what are the conditions in which we have hirsutism? One of the most common causes of hirsutism is PCOD, which is polycystic ovarian syndrome, in which we have obesity, infertility, and irregular periods. And sometimes we have multiple cysts in the ovaries. Second one would be Cushing syndrome, in which we have high levels of cortisols as a result of taking drugs such as prednisone, danazol, and Prozac, or could be caused by overworking of hypophysis, which is a gland in our brain, or adrenal gland, which is a gland on top of our kidneys. The other reason would be congenital adrenal hyperplasia. As discussed, adrenal glands are the gland on top of the kidneys, but sometimes overworking or overproduction of cells in that area could cause high level of steroid hormones. One of the other reasons would be tumors, which is rarely happening, but we have it in our adrenal or ovaries, adrenal glands or ovaries, and sometimes we have them with a high secretion of those hormones. Sometimes we have very mild conditions. And even if we run the test, we couldn't find anything in the routine test. So what are the solutions in these conditions? So to find minimal changes in our hormone, in our blood levels of, for example, testosterone, estrogen, and progesterone, we could actually measure the different part of those hormones. For example, for testosterone, we could have total testosterone, bioavailable testosterone, or free testosterone. And even so, we couldn't find any changes in our hormones, even if we actually run different blood tests. Now we could use a test called Dutch test, which is dried urine test. It actually measures all the metabolites of the hormones, including the cortisol, which is releasing from the adrenal gland on top of our kidneys. In any case, when we couldn't find anything in our blood tests, or routine blood tests, or even more precise blood tests, and we still have the symptoms and signs, we're going to introduce some phytoestrogens in our plant-based diet or in our diet, including all the ingredients that you can see in this picture, which is tofu and soybeans and soy milk and green beans and some in form of pills and liquids of phytoestrogens. And also, what we could do is to do the detoxification of the liver, since the sex hormones or reproductive hormones are derived from cholesterol, which is being made in our liver. So I'm not trying to enter to the subject of treatment plan for PCOD or any other minimal hormonal imbalances, but after treatment of PCOD, a proper treatment for 2 to 3 months, then we could actually consider having a local hair removal laser, for example. So I hope you enjoyed the video, and I hope this video could actually help you to choose the best decision as to how you could address the minimal hormonal imbalances, signs and symptoms, not being confused in terms of how to do, specifically when you don't get a proper response from your own physician or your own practitioner. Thanks and have a great day.